Applestosen. It's Dr. Bob here with another health and vitality tip of the week. So today we're talking about a very common problem called radiating pain. Radiating typically means that it's coming from a central source. Most of the time it's the spine. So if a person has radiating pain that's going down into the arm, you could have numbness or tingling, maybe certain fingers, very specific, your 7th nerve, your 6th nerve, your 5th nerve. There are very specific ways to determine where that radiating pain is coming from by evaluating the nervous system. So anytime you have any type of numbness, tingling, loss of strength, weakness in through an arm or leg, things like sciatica, the largest nerve in your entire body is called the sciatic nerve. There's actually 8 different branches that come about. So having a doctor evaluate it, specifically a chiropractor that deals with specializing in removing pressure on the nerves that come out of the spine, is important. So this nerve pathway chart behind me, if I push, say, the lower lumbar nerves, if I push on this, think of this as like the fuse box of your body. And if you look, these nerves actually travel down the legs. So if there's a problem here, it actually affects the radiating nerves down to the outside part of the knee. So if it's in the upper lumbar spine, it's typically going to go to the upper part of the leg. If it's in the lower lumbar spine, it typically goes all the way down into the feet. So you can have things that might mimic plantar fasciitis, fallen arches, chronic ankle problems, calf spasms, because these nerves go all the way down into the feet. So it's important to evaluate where is the problem coming from. If your spine was your fuse box, you wouldn't want to just go replacing light bulbs, replacing fixtures. You would actually go back to the fuse box first, see if there might be a blown circuit back at that level. So think about it. There's 24 openings for all these nerves to come out to go to all parts of the body. So as a chiropractor, our main focus is to take stress off of the nervous system to an evaluation, look at the muscular strength, feel the movement of the spine, make sure there's no pressure on that area, and then make a very precise adjustment to realign the spine to take stress off of those nerves. So if a person ever has radiating arm pain, leg pain, whether it be yourself, a husband, a wife, kids, aunts, uncles, somebody that has that, having an injection into the area does not fix the problem. We are not suffering from not enough drugs in our body. We are suffering typically from some sort of imbalance or pressure on the nerves. So it's important to evaluate this to make sure that you do not have stress on the nerves that will cause radiating pain. So get a chiropractic evaluation, look at your posture, look at the range of motion, and make sure you get things taken care of. So this is another health and vitality tip from Dr. Bob. Until next time, Applestosen.